This week, delegates from the town of Dartmouth were invited to take a tour of the field hospital set up at UMass. While we were there, we met with officials from South Coast Hospital Group who gave us a rundown of how the facility was set up and how it works.
Hi, my name is Kelly Shanley. I am the operational director of the Dartmouth Field Hospital for South Coast, UMass Dartmouth, as well as MEMA. The field hospital is just under 100 beds, and we are considered an extension of South Coast Hospitals Group under the hospital's license, and we are a 98-bed med-surge hospital ready for any overflow patients that may be required to be transferred here from any of the South Coast hospitals to make room for other patients that may need to come to the hospital with a higher acuity. The patients that will be transferred will come here for hydration, antibiotic, nutrition, ambulation, low-level oxygen needs, fairly stable patients. This is the cubicle in which they will reside for however long they need to. Each cubicle has some protective and privacy curtains, as well as a cot with laundry so that they can have clean laundry and linen. And it's essentially a sleeping bag in a bag with some support for comfort. We also have the over-bed tables with little mini lights so that if the patient had to ambulate to the bathroom, they have a light at nighttime. We also have IV poles, and they have an IV pump that is very similar to what we use at the med-surge area in the hospital. This is also programmed with the same medication library, if you will, so that staff can measure their medication similarly as they do in the hospital. We also have, each cubicle will have a vital sign machine which is able to take temperature, blood pressure, pulse, and their oxygen level. Everything is on wheels so that they can ambulate around and kind of get ready to go home. We also, on each IV pole, have an extension for them which have USB ports on them so that the patients can contact their family and loved ones via their devices. So it's a USB port. We have 2 for phones, iPads, whatever the needs are. Poor patients can't have visitors, so we want to make this as comfortable as possible for them. So what you see here is an exact replica of what you would see in a hospital med-surge unit. We have staff, a medical director, RNs, nursing assistants, medical assistants, and an addition of paramedics that will staff 24/7. And they're here particularly in case we need to do that intubation. So putting in a breathing tube. We're hoping that the clientele that come are fairly stable and again, getting ready to go home. But we also need to function at a hospital level where we have adequate medical equipment and supplies to meet the needs of the patient. We also have X-ray so that we could do portable chest films to make sure that their pneumonias or their lung status is clear and getting better rather than worse. We also have a full lab that we can do blood tests just as they do in the hospital for chemistries and blood counts. And we also have an electronic interpreting system in place so that our patient population that are non-English speaking will have the ability to communicate their needs, and we'll be able to teach to them about the care when they're getting ready to go home. Every patient also will have nursing assistants that will help keep them occupied. There's not much to do around here in a gym, so we have goodie bags that our marketing people have supplied that have some busy work that patients can do to occupy their time when they're not able to speak with loved ones.
Hi, my name is Helio Rosa. I'm the Director of Design, Construction, and Property Management for South Coast Health, and I'm really representative of a larger group of staff and leaders that really helped implement the field hospital here, whether it was from a layout standpoint, infrastructure, IT, clinical engineering, facilities. We really ran the gamut in preparing the the space for use as a fully licensed medical surge facility. What we did is when we arrived at UMass, this was a completely empty gym, and what we're talking about is a gym that's big enough to hold 3 basketball courts. And when we arrived, it was empty. Working with MEMA, they took about a day and a half to set up the walls, the partitions, and they provided us a cot with associated linens. Everything else from that point forward was the responsibility of South Coast to prepare for use as an actual hospital. So once MEMA left the space to us, then we took over to bring in IT infrastructure, for example. Each cubicle has the ability to be wired back to the hospital system. In about 50 of the bays, we brought in piped oxygen to serve our patients that may need it. So in the course of about less than 2 weeks, we turned an empty gym into the 100-bay space that you see here. And through the course of that time, through a lot of efforts of a lot of leadership and a lot of support staff, we are now a fully licensed hospital facility.
Chancellor Johnson and the entire UMass community thinks that we're really a big part of the local community, and we don't want to just talk the talk, but we want to walk the walk. And I think we've got a great relationship with South Coast. We work with them in internships and clinical relationships and with our nursing program. So it's a natural progression for us to partner with the hospital on this. So Chancellor Johnson and President Hovan got together and reached agreement, and I've been fortunate to be part of this build-out process with the hospital over the last several weeks, and it's been quite the sight. But with MEMA and South Coast transforming, 3 basketball courts into a hospital has really been quite something to see. And I just want to thank the people at UMass that have worked on this, from Chancellor Johnson to the facilities people to the financial people and contracts and security. The chief of police has been wonderful. So it's been a team effort at our end, working with the South Coast team, and I know we're happy to be part of this.